Yeah, I feel like the proliferation of like TikTok diagnoses are doing way more harm than good.
Yeah.
I mean, the number of particularly like Gen Z people who think they have multiple personalities is just like off the charts.
It is like the most fake thing in the world. And it's like I've been doing this again just post graduation since 2019. I've never seen somebody with it. It makes you question like, is it actually real? And again, I don't really know much about it, so I don't want to speak to it too much. But it's like it is like for sure the most fake disorder. Like everybody that would walk
Yeah.
into the clinic, you could like sit there with them for like 30 minutes and be like, this isn't real. Like you're making this up for one reason or the other.
So they call it DID now, dissociative identity disorder. And I'm not 100% sure it's a real thing, but if it is a real thing, it affects like 1 in 10,000 people. And like, I feel like 1 out of every 3 Gen Z people think they have it.
Yeah. I mean, this in theory, like I definitely remember like learning about it in grad school, and they're like, oh, their whole physiology changes. They've got one personality has diabetes and one doesn't. I'd like to see the studies on that. I'd
Yeah.
like to see where it's actually coming from. I'm not saying it doesn't exist, but like I would like to read it myself instead of just seeing a TikTok video on it or like a blurb in a textbook, just because like I tend to like question everything now.
I would say you can safely say that 100% of people who claim to have multiple personalities while they're on trial for a crime are faking it.
Yes, I would agree with that. Yep. They're probably sane in a sense that like they know what they're doing. It's
So go ahead. Sorry.
no, that's it. Like it's nuts. Like I can't believe the amount of people that like think it's a good idea to like even pretend to have like mental health disorders on TikTok. Like I don't understand that trend
There's
at
like,
all.
there's like some social capital that comes from having a diagnosis.
Yeah, I mean it is because people like use it as a label. Like I'm anxious, like I'll take my like anti-anxieties with my Starbucks and I'm like, are we bragging? Like I feel like we went too far. Like it was like decrease the stigma, but like we went way too far. We got to like correct it a little bit. Like
I feel like
you
if
shouldn't
I'm,
have anxiety forever. Like it should
yeah,
be like
yeah.
you treat it and you're good. Again, anxiety is a normal emotion within a certain range. Pull her back in and like you should be good.
I feel like if I'm a heterosexual white guy, that's like A, super vanilla, it's boring, and B, you don't get any intersectionality points for that. And so if I'm
No.
like desperate for social capital, it's like, well, I have depression and I have multiple personalities, and it's like I'm grasping for some kind of social relevance, basically.